Okay, so Mimi is our first subject today, and she has a lot of things that will improve. She has great skin. This vellus hair and elastic type skin really responds well. She has just really early softening, so she's had flattening here in the zygoma to cause descent of the cheek, to cause the nasolabial fold to start forming, some wrinkling in the forehead and crow's feet area. Her left side's actually a little longer than the right, but it does sit a little lower. And when they're really not all that asymmetric, it's less critical. I also look at the asymmetry in the jaw. There are some people who she flares pretty symmetrically at 45 degrees in each direction, but some people have 60 degrees and 45, and you just have to notice that because you may treat and treat trying to get a flatter contour when it's bony problem causing it. We can start on her forehead, I guess. There is no rhyme or reason to start low or start high. So I'll go to 18. She's got relatively thin skin, a prominent bony boss over her forehead. Now this goes from warm to warmer, okay? And what we don't want it to do is to get to hot where you want to pull away. So if I'm not moving just in the nick of time, just raise a finger or just say, that's getting hot. So at that setting for the forehead, I'm going to treat the forehead, the lateral orbit, and the inferior orbit as well, because those are the most sensitive areas, so we use the lower setting. That's okay. So I'll use the handpiece. I'll make contact with the skin. Again, I kind of like to get into the habit of using your handpiece to spread your gel, and that way you'll never activate it before you touch. And then we just activate it. Now, how do we know if we're at the right setting? The first thing is that she's not saying, oh my God, that's hot. So if you were at some super high setting relative to what she was going to tolerate, just making contact and starting to swirl, she'd complain. So we know we're not there. I use long parallel strokes along the brow. I might use small swirls as I go up in the forehead. I go parallel and perpendicular to forehead lines. And again, a generous amount of gel. And again, getting that to temperature right in that area doesn't mean I'm necessarily done with the pass. I want to make sure I have the whole area confluently heated. And right now, with this last pass, with this last movement, I was actually starting to see movement in the contraction in the brow, and that was at 41, 42. So I'm at a therapeutic endpoint. Yeah, I will sit her up each section so you can see. But this, like right now, as I come across this temporal area, I'm seeing it draw up each time I pass over there. On the glabella, remember, she has a low horizontal line there, so I want to draw up. If you want to keep tearing me off some sheets, I want to draw up on that glabella and tense it so that I can get some energy down there without gapping there. Just 2 passes in a relatively thin forehead. I'm going to feel the tissue, and I can feel that this is a lot more dense than this is. When I move the tissue, this is a lot stiffer than this. So I'm getting the firming. And again, you see me moving a little faster now because I know she's getting up there temperature-wise. So I move faster so she tolerates it. Notice we haven't had to change the energy level. We found a nice happy place with the energy level, and instead of having to dial up, dial down, we're just able to change our intensity by how slowly we move and how much area we cover at a time. That brow keeps twitching up every time I get near it. That's nice response. The firmness is something we can't show you. You just have to get used to it. But if I were airbrushing and not barely touching, she would constantly get a little zap. So you really want to be firm enough not to lose contact, especially as you go around a curve like this. You don't want to jump off.
And I can actually feel my skin feels firm from here, from this end.
You can already feel that tightening in the brow. Go ahead and raise your brows. See the difference in the depth of the wrinkles raise up? See how this is much softer and stands up higher than this? This is where my thought is that if we Botox these people before and make it so she can't re-wrinkle this for 4 months, I think the results will be better. So I'm going to apply the gel now from the midline of the chin all the way to the temple, upper lip lines.
Those lines really bother me.
The ones on your lip?
Yeah. Because I never smoke cigarettes. Why do I have lines on my lip?
So everybody shrinks inside and you end up with more lip than you need, and it just bunches up.
That's what I've been told. Oh, I have more lip than
People
I need.
with dentures especially will have a lot of redundancy. Okay, so I turned the, she was treated at 18, which is a relatively low temperature for the forehead. She's a small person, so I'm going to start at 28 with her, whereas I might start at 34 or so on John, for instance. And again, you want to find a temperature where you can work at a reasonable speed so you don't take too long, but where you're just not hurting the patient. So I want to work from the jawline. I'll start swooping under there in a little bit, and I circle the mouth. You can hold a little pressure from the other side on the lip lines. To reduce the nasolabial fold, we're going to start by heating the high side parallel to it and heating the fold itself. Reading her body language, knowing it's time to move on. And then I work this J-shaped area where we're really going to emphasize the contraction and push her malar prominence up. She's got some volume loss laterally that's caused flattening here, but she's got some really nice volume medially. So we want to take advantage of that and try to get it back up where it used to be. So this is about the third time I've had to go over it to get it up to temperature, and you see she's reacted already a little, and I've persisted just because I want to make sure I have the whole treatment area. And on the temple, now that you've turned it up and you're going back on the temple, which is relatively sensitive, you hear me going on and off, and I'm just treating more gingerly there. So let's see. .42 down here in the lower cheek, only about 35 up there on the temple. 40, so that's pretty confluently heated. So this is just a single pass. Turn your face this way. And this is this pinch test. And granted, it's slippery over here, but tell them what you can feel in the texture of your face.
I can feel it from here. I feel like I'm missing some skin over there.
Yeah, it's just a great initial response. So this is that pinch test, and the patients really do get excited about it. It lets you assess what you're getting to. And again, she's got this nice soft fat pad, but not too soft. So I'm going to, again, help push that up. I may heat over it a few times, but I don't want to lower that too much for her. All right, so about now is when I'm actually seeing it contract as I go over it. So you'll get to a point with every patient where, as I go back and forth here, I'm literally seeing it kind of shrink under my probe, getting even tighter. And so we know we've gotten beyond the point of initial contraction, and now we'll see how long it takes to get to the point of minimal further contraction. Don't forget the chin. The chin ages and becomes soft and amorphous, so you get some nice firming and shaping of the chin. In her case, you'll probably see it kind of pointing in one direction after we've treated just one half. So just a couple passes over that malar pad to firm the surface. And you can see it doesn't matter if I'm doing circles. I'm controlling the tips so that I don't go flying off and causing a spark. I'm pressing firm enough that she probably feels like she's getting ironed, but it's not painful.
It also looks like you're avoiding the vermilion part of your lips, correct?
Yeah, there's no reason to avoid the vermilion. Actually, in some patients, I'll put the gel on and treat the mucosa also. It's kind of difficult to stay on the vermilion, so I kind of have them hold their lip, and I actually might put a little 2x2 underneath there at that point because it's really easy to slide off. Haven't taken any crowns off yet, but you can get a little bit of smoothing in the mucosa as well. Where are you from on a scale of 1 to 10? Where is it heat-wise right now?
5 or 6.
Okay, so watch what happens at 5 or 6. If I decrease how much area I'm covering, it only takes a little bit of time to get up to 8.
Yeah.
So you just kind of know, you'll learn. My patients realize that if I'm asking, is that too hot, they know it's about to get too hot. Because I know from the redness, and again, I'm feeling heat radiate off the patient on the back of my hand. I know that I'm getting close. Okay, go ahead and sit up and let's see how things look. I'll swing you around toward the camera there. Let's see what you think.
Oh, wow.
Unprovoked wow, that's what we go for every time.
This here, I used to have a really big thing here.
And
And look, you know, one side definitely doesn't match the other.
She has a big difference in her nasolabial fold.
yeah, if you look at the depth of the angle of her nasolabial fold, that's what indicates the cheek's gone up.
Her brow is higher.
Yeah.
So again, I would warn her that the brow in this area, the jawline, is going to be a little puffy day 2, 3, 4 because there's a lot of heat accumulated there that's going to continue to cause some mild swelling, which is all part of the healing process. And that eliminates the phone calls from people who think it's going away. And then, of course, at 4 or 5 weeks, it'll be really solid. But your real goal is to go to that unprovoked wow in every case, and it's really not unusual at all.
Yeah, I really see a difference. And there used to be some real strong lines here.